Good afternoon. This is UMACO TV. My name is Kemal Erkan. I'm here with Sean Donegan as part of United Medical ACO. This is our weekly event. We are going to update you with some of our routine items, and there are some new items. And we do have a guest speaker from United Medical RCM team. Carlo Manhart is going to be with us, and we are going to go ahead and start. Sean, how are you doing?
Not too bad. How about yourself?
Good. So other than the heat and how the weather is, I don't have any complaints. So we can get our COVID updates, and then after that, we are going to have Carlos joining us.
Yep. So this week, our COVID updates may be a little bit more lengthy than usual because we have a couple of articles in the news relating to COVID that we wanted to touch on. First of those seen here displayed is the fact that President Biden did test positive for COVID and that his symptoms were improving over the last couple of days with the note there from his doctor saying that his oxygen saturation, his respiratory rate are normal. So it doesn't look like it's going to be too serious. Touching back, we did notice that when we were seeing the rise in cases, even though the numbers were high, that the symptoms were not as severe as past. So Biden's case here also resembles that he seems to be doing all right, even though he did test positive.
Now, the day before he was tested positive, he was also saying that he had cancer, right? So this came right after. I don't know what's happening there. So
I'll definitely have to follow up on that. It's kind of a bang, back to back.
Like the COVID just took the attention away from the cancer. Like we don't know if he has it or not. I think that's an important update.
Definitely significant, yeah. So we'll see if by next week we can get some clarification on what exactly that was, what type, how severe. But yeah, like you're saying, everyone seemed to be focused on the COVID part. That was more recent. And one of the other things we want to point out with this was just the media's attention on Biden testing positive versus back when President Trump was still in office, the reaction to him, how each of the presidents handled it, their days immediate after. So one of the criticisms we had here was Joe Biden was still at his desk working without wearing a mask, even though he had just tested positive. So a lot of people are criticizing that. And the White House defended that maskless photo, saying that the reason that he wasn't wearing a mask was because they wanted to show the people that he was back at his desk working, as if it was a normal day to him. Kind of that things were on the steady, that it wasn't anything to be too alarmed about. So kind of some hypocrisy there with the different viewpoints on how testing positive and the protocol after regarding quarantine and wearing a mask for at least the 14 days and how all that has sort of changed and how the media is choosing to present that to us. So we wanted to make a note on that.
I think one of the reasons for the confusion is Dr. Fauci. I know we have updates on him, but I think he was, from the beginning, he was not clear, and he did one thing and then he did something else, and then something else happened, and then everything changed. So I was like, I have a quote unquote relationship with him. It was up and down in a way that there were times that I thought he was doing a good job. And then there was time where he was really not doing what he's supposed to be doing. In my opinion, he's way too old for that job. Maybe what the job is demanding is not what he's able to do. But I think that he was part of that confusion.
Yeah, I would agree on that. And we know that when the initial COVID happened back in 2020, and even the different variants afterwards, that there was always constant change on those guidelines where 1 week, you're isolated, you're not allowed to leave the house. Then it was only wear a mask if you're within 6 feet. So we know that there was a lot of changes on that protocol procedure as these different variants happen. But, it has been a few years now. But also just to touch on what you were saying there, Dr. Fauci, in the news, there was a release that he plans to retire by the end of President Biden's term. So with that, another quote was that he wasn't know if it was going to be sometime in the near immediate future or whether
it's 2 more years.
Yeah,
he's
or whether he's
already 80, 81. So I don't know why he needs this job.
Yeah, so it said he could anywhere from the near future or at the end of another 2 years. So it's unclear on what that timeline's looking like, but it is a looming event that's going to be upcoming at some point.
So we'll have a retirement party for him.
There we go. And then one other thing in here was the cartoon of the week, saying again, another new variant. So it seems to be a thing that we expected, the fact that, these viruses are always mutating and forming new variants off of that. So it seems like it's going to be something that we will have to get used to living with, just as your typical seasonal flu is something that, there's a new strand, they always update their vaccines, but I don't think it's going to be something that will be eradicated per se, as some people may have initially expected. And then just one closing thing here with our numbers. The site that we were normally using was the Reuters Global Tracker, which is what we were using for the majority of our updates for the past, I think ever since we started this.
So, well, actually, I was using Wordometer in the beginning. So when you started with me, we changed.
So that's October of 21.
Yeah.
We've been relying on Reuters. And it's actually just this past week, it says their last updated for July 15th, and that the pandemic statistics on this page are no longer being updated. So what we're going to do here at United Medical is kind of see if we can find an alternative, whether we're going to go back to the Worldometer. We did have some other ones from the CDC, New York Times, different numbers reporting. We just want to make sure we dive into that a little bit more in depth and see which one's going to be the most accurate, most reliable before we kind of pick a source that we're going to use, because we know that with certain data.
Yeah, I think we
there's a
can
lot
go
of
back to
variation.
Wordometer. That was reliable.
Yep.
So now with COVID, I guess the personal experience these days, it's kind of like hit and miss. So there are some people who are actually having symptoms and they're actually going through some severe process of the disease.
Yeah.
And there are some people, they don't know they have it. But I do hear more people getting it. In fact, a couple of people that I know that back to back they had. So not sure when to feel safe or when to stop actually being precautions or taking precautions steps. But I think we really need to protect ourselves and don't expect much from anyone else. So, going back to the old habits, at least like certain physical interactions with people and being in places that you don't really need to be. I think that's just like as simple as that is going to be. And in some cases, just wear your mask when you don't feel like. I tell my parents to wear their mask when they're in public. So at least we can maybe, but we cannot stop living our lives. So that's not going to happen.
It's going to have to be like a medium blend there. Like obviously if you're in a really crowded area, urban, obviously.
Outdoors.
Yeah.
Yep. So did we have everything on?
Yep. So with the COVID, just to wrap up this number wise, the US was looking at around 130,000 new cases. So again, that is slowly upticking from that plateau we saw a few months ago. But we are going into almost August now. So we have fall and winter months coming up. So with the new variant too, could be expected to rise.
Well, thank you. And I'm going to let Carlos join us. He's in the waiting room.
Hey, Kemal.
Hey, Carlos, how are you doing?
I'm good. How are you doing?
Good. Thank you for joining us.
Thanks for having me.
Of course. So, this is the third or the fourth time that you.
I think it's gonna be the third time that I'm here with you. So
sure. So if Sean doesn't break things here, so he just covering his camera. Okay, so we are going to discuss the interconnected systems in United Medical. So as part of our one of the reasons that we do this, other than reaching out to patient and public, we also want to communicate with our employees and our providers who are utilizing our services. So that's part of the reason that we are having you guys giving us updates on RCM side. So you're on.
Of course. So no, thank you, Kemal. Thanks, El, for having me. As you mentioned, my name is Carlos Meinhardt, and I'm one of the associate directors for the RCM team here at United Medical. And I will be giving a brief overview of what the EMR is, the PM system, and QuickBase, and how these systems interconnect and interact with each other, and how our team uses the systems to run some of our day-to-day tasks. So I'll start with PowerChart. It's a hybrid electronic medical record solution that caters to clinicians, and it goes from small private practices to large hospital systems. PowerChart is designed to help with like multi-entity electronic medical record creation, and this solution can be hosted on the cloud, on-premise. Another important aspect to highlight from PowerChart is that it coordinates the care between multiple locations and practitioners, and it helps the office staff manage medical record processes while still offering flexible documentation options. I think one prime example of this is how our United Medical ACO shares the same PowerChart domain and how it is useful for all our providers in our network. Now, I'm going to go over SPM, Kemal, unless you have anything to add on the PowerChart side. SPM, it is one of the PM systems that we manage and that we handle here at United Medical. It stands for Specialty Management System, and is part of the Cerner family of clinical practice management solutions. It is integrated with PowerChart, and it offers medical document management, patient appointment scheduling, and health record management. And one of the key aspects is SPM is key to our RCM flow, as it allows us to submit claims to the insurance companies in real time after the patient is seen by the provider, pretty much. The other system that we use is CPM, in which we currently have 7 practices for a variety of specialties. We have from employer clinics, pediatrics, the surgery center, and a family practice. So it's another system that we also work with. And I'm going to quickly go over QuickBase and what it is. QuickBase is a cloud database software platform that creates custom applications that solve business challenges and that cater to the specific needs of the client or us in our case. And here at United Medical, we use it for client communication, productivity tracking, project management, and financial reporting, among other things. And Kemal, every time that we have this live sessions, I go back to one of the live sessions that we had together, refer to my notes, and I always go back to the time where you told us that QuickBase was not available when we first started. And as we start working with more clients and more specialties and more complex processes, it was something that was needed. I've been with United Medical for 8 years, and I cannot see United Medical without QuickBase. So it's an important tool that we use for here at United Medical. Next is how do these systems all interact with each other? And it all starts at the doctor's office. So patient goes through the patient registration and the insurance verification process by the office staff, and then the patient is seen by the provider. Then the provider documents all of this information and all of the visit information in PowerChart, and they add all of the CPT2 codes and diagnosis codes to the patient medical record. Then this information gets transmitted to our PM system, SPM, from the EMR, and after that, the office will go in and make sure that all the information that the provider added to the medical record is valid, and it gets entered into the patient's ledger. Our claim department then sends this information to the payer for payment. Now, there could be instances in which the payer, after we submit those claims to the insurance, may not pay for may pay for the claim due to specific reasons. Sometimes it's billing errors. If the practice sends a visit with the incorrect CPT code or the incorrect diagnosis code, we could get a denial. And one of the examples that I provided in the slides that we have on the bottom is there's times when we get a denial from the insurance because incorrect diagnosis was sent or a mutually exclusive diagnosis was sent to the insurance. In this instance, we do reach out to the provider using QuickBase to get the updated diagnosis information. So that's one of the things that we use QuickBase for. Another reason, I mean, after we submit the corrected claim to the insurance and we obtain payment, we also go ahead and post that information into our PM system, an SPM. And at the end of every month, we gather all of the financial related information from the PM system and upload it into QuickBase. And that's another thing that I added in the slides, in which we gather all of our end of month reporting, which we then share with our clients during our end of month meetings. So that those end of month reports contain denial management information, along with all of the financial information data, but it's broken down by CPT, by date. So it just depends on the provider and what they're looking for.
So, Carlos, I actually tried to put this image on the, yes, when you're looking at it, it's on the left side, right?
Mm-hmm,
So,
yeah.
of the screen. So, between the three different systems, practice management, there are two of them, SPM and CPM.
Yeah.
On the other side, we have our power chart, which what makes United Medical ACO and United Medical setup is unique is we have, it's called logical domain, which is there's one chart, one patient. So we have several different practices. They are owned by different individuals, but when it comes to the clinical integration, we are one organization. So although that's like everyone may say that they are using PowerChart, but there isn't any other healthcare organization in the United States is using this in the same setting that we are using. So that's extremely unique from that point. Now, one of the, I guess, the questions that we get from the clients, well, if the SPM or the CPM, if they are like so great, well, why do you need QuickBase, right? So, well, QuickBase actually, although it's kind of like the small box in this picture, well, we actually do almost business integration and some of our clinical integration in QuickBase, because one of the important part of business is standardization and unifying the way that we work, the policies, procedures, and how these things are available for different individuals in different levels. So the practice management system is going to provide the reports, the data for the reports, but the way that we mine those reports is not going to be ideal. So one of the things that we did in QuickBase is standardizing our monthly reporting, right? So that actually, while we were using that, we also used QuickBase for our internal communication with our tasks and our other projects. And then we added, on top of that, we added our client communication. On top of it, we add our population health management, our admission discharge process, and it just becomes, it became like a pretty big deal right now. So the way that we are using, and it's not designed, we program these, myself, John Donnelly, and other individuals, you are part of some of the applications. We build it together, but between myself and John, we build most of the applications. Right now, probably John is better than me in terms of the building knowledge, but I probably have more practical knowledge. So, but that's what makes it best. So then we can actually get the most out of the out of the QuickBase because it empowers UM and UM clients in a way that's that extra push that we are able to get. So then it becomes easier to standardize certain things for us, right?
Correct. Yeah, so it is very useful, and again, even from our internal management to assign different projects to our teams, especially for us on the billing side, the use of the different agent reports and the quad communication, it does make it very easy, and it's very helpful.
No, absolutely. Now we also have we are using QuickBase for patient satisfaction surveys as well as the billing inquiries, which we did cover some of those in different sessions, different episodes of this event. So any feedback that you are getting from the clients in terms of their experience with the system?
I think everything's been positive, Kemal, especially with the different measures that we have internally, which we try to answer tickets after oral client communication after a specific amount of time. We're trying to stay on top of that, and I think it's the easiest way for our clients to get to us if they're not able to answer a question from the patient's ledger or anything like that. So overall, in what we see from the satisfaction surveys, everything's been positive. Everything's been, from the responses that we've seen, they all agree, and they all very thankful and appreciative of the system that we have in place.
All right. So anything else you would like to add, Carlos, before?
That's all I had, Kemal. I don't know if there's anything else that you want to go over or anything specifically.
We were at the tennis event last Tuesday night.
Yes, Tuesday night.
Right, that was at the Palm Country Club. I think there's still that's not over until Sunday apparently. So
I think it goes until Sunday.
You're sponsoring that event, so that was a fun event.
Yeah, that was very fun. It was. I didn't know how big it was, like in Delaware, a lot of people come from different states and stuff to play.
So it's good to see you guys there, though.
Yeah.
All right. Well, thank you so much again, and I'm hoping we'll see you soon.
Sounds good. Thank you, Kemal. Thanks for having me. Bye-bye.
We are going to continue with our the global crisis, right? Or global events. Let's not call it global crisis. So that sounds like, well, unfortunately, right now it is a global crisis. So
I think I'm blurry there.
yeah, I think you may need to. Yeah, no, I think you need to plug it and unplug it. You play with that one too much. So Sean is going to join us in a second. So we're in the same room, so I do see him right now. So I'm going to actually restart this one because one of the and you need to turn the camera on again. Yeah. Okay, now you are clear again. All right. So I was just saying that with the global events, you know, I do get a lot of criticism from different friends and family members and some of the other people when we are talking about the global events. So I do want to actually congratulate President Erdogan for his efforts in the peace talk with Ukraine and Russia. And what I learned actually this morning was extremely exciting, that he was able to get the deal between Zelensky and Putin for the grains to be released, right? So
correct. Yeah. So with the Russian invasion, what was happening was the grains that were on board all the ships, I believe it says here it was the Black Sea ports where they're being stored. With the Russian invasion, it was actually preventing the Ukrainian grains from being exported out of there. So with this deal that was just signed, they're able now to export the grain, which is obviously a huge impact on the rest of the world. And we're going to touch on it a little bit later, how there's a famine actually going on in Eastern Africa. And obviously with this new deal that's releasing the grain exports, that's going to have a big impact on that for sure. So as you mentioned, it was actually in Istanbul where this was taking place. So as you've been mentioning throughout this entire ordeal with the Russian invasion, Turkey's been playing a big role, even though the media might not necessarily be projecting it that way.
Or giving credit to what this guy was doing, because until like a couple of months ago, they were calling him a dictator, but he's the peacemaker.
Mm-hmm.
So I never voted for him. So that's because I was not interested. So my dad is a big fan of him, but we have agreements and disagreements. But one thing that you have to give it to him is in this crisis time, that what he's able to do. And if he was some dictator, he wouldn't be able to do what he did, and he would take advantage of the situation, honestly. So, and if the dictator becomes a peacemaker, so those people who call him dictator needs to really start looking into their own act, because they may not have the best judgment. So we do congratulate him for his efforts, and I think this actually is not about us supporting one person to the other. So when in the Africa issue that we have, like what's happening today, when these things are not happening, who's being impacted? So you and I, we are going to probably not eat certain things because there's a shortage, but we are not going to die from what we don't get. Right. So this impacts people in Africa, in other part of the world, at a greater level. So, and I think this deal that they just signed, the grain export deal, that is going to probably relieve a lot of people. It's going to give a lot of relief to the people who are actually at the edge of the starvation. So
yeah, I mean, whenever you have global issues like this, I don't think that the parties that are involved, they have their agenda that they're maybe more focused on, which is understandable, but they don't realize the ripple effect of what it has on the fact that there's, countries on East Africa now that there's people literally starving to death because of just this invasion, and the effect that these other political powers and countries have on a global scale. So like you said, it's really good that passed, and hopefully they're able to get, the needed supply to these areas that need it the most desperately as soon as possible.
So just to kind of dive into the Africa issue, right now between the three countries, Ethiopia, Somalia, and Sudan, I believe, South Sudan. So these countries are already feeling great pressure. So it doesn't really have anything to do maybe with the Ukraine deal, because even before that, there are huge trouble. People are not able to get access to food. People are not able to get access to clean food or clean water. And now the supply chain issue, and then the shortage of the supply. This is now, again, they are at the edge of the starvation. And this is going to become even worse if this is not this, the transportation issue and getting these on time is not being completed, because they cannot wait.
No.
In the meantime, so we see these countries in a way that they are kind of part of the political games that they have no power, they have no control over, but they are being the peon of these games, and then who's suffering is the people of these countries. So Dr. Erkan and I, we did so much work for Tigray, and again, it's extremely depressing, even just to watch some of the news and read the news and understand why this is happening, and then not being able to solve the problem. And you can only do so much from the individual level. And now understanding that any other financial or the war type of crisis, some other part of the world still can have a huge impact in these countries.
Yeah. And like you're saying, sometimes that there may not necessarily be a solution that's right up front and plain and obvious.
Mhm.
But other times, there are certain compromises that maybe can be made a lot sooner than that ends up turning out to. This was end of February, and now, if their supplies have been cut off for months now, I'm sure there could have been a compromise or some sort of solution resolved or arrived at a little bit sooner. But in the grand scheme of things, I'd say it's great that this did happen now, better than never. But like you're just saying, with these larger political powers and what their agendas are, sometimes it's harder. And as you mentioned, it's, the average day citizen in these countries who, I'm sure they have no greater motive with this conflict, but they're the ones who actually end up suffering.
So this is just going to put, these types of stuff is putting extra stress on these countries. So the biggest fear is this destabilization and the displacement of people. So we already have the problem from Syria to Europe when people are trying to migrate. So that's already there. So we know what Greece is doing, what the other countries are doing to protect their own borders. And in some of them, in some cases, that looks incredibly inhumane. But if we don't do the right thing, then these types of movements are going to happen more. So because we're going to see people from what happened last week, we were talking about Libya, what happened in Libya. So then after Gaddafi was gone, now they are killing each other. So there's no leadership. That's the part of the region being not stable. So now, if those people are not happy and then they want to move from where they are, that's going to impact everyone else's life. So that's probably what we have to say there. Yeah, and just to add on that, with some of these actions that these countries or people have to take, sometimes, by not taking initial decision maker, initial action right off the bat, you almost corner yourself or pigeonhole yourself into, this is the only solution we have at this point. Since we waited so long, the other options are now off the table, where it's this is the only thing we have left to do. And sometimes it's not an ideal action or a resolution that, you're looking at other possibilities initially on. Could have been way more preferred, but now that's kind of what you're forced into. That is absolutely right. So, so what else do we have from the global slide, Sean? Yep. So we did mention the grain deal, as we just talked on that. We also have the EU did defreeze some of the Russian assets to enable trade in food of fertilizers, which again, that leads on to the grain deal that we just mentioned there, that Ukraine and Russia were able to get done, which we touched on the famine. And then also in South Africa, there's more protests actually going on there. So a little bit more unease. We know on the last week's session, we mentioned various spots across the globe, whether Europe, Africa, Middle East. We had some in Asia, that there was this unrest and unease and this tension, turmoil kind of growing. So now we are seeing more spots popping up across this global map of where the people are just unhappy with this unrest and they kind of want a change. And I think a common thing there is obviously with the economy. We know that the U.S. is facing inflation and economic woes right now, but there's other places in the world that are seeing it a lot more severe. And it's understandable that they'd be wanting to protest and kind of make their voices heard, that they want some change and action taken. So, yeah, I mean, those some seem like isolated events, but they're not. There's like very similar, like the when you look at what's actually happening in these countries, these protests and others. So what you see is there's something common. So the way that it's organized, the way that it started, the way that it's reaching out to people. Yeah. We talked about Sri Lanka for a long time, and that country is done. It's over. So I think it's going to be worse than Afghanistan, unfortunately. Yeah. So because you do need leadership in order for in order to have the proper stable country, and then if you don't have the leadership, that's not going to be the case. So now those people are in the bedroom of that president of Sri Lanka they're ruining their future And unfortunately, there's nothing much we can do other than just talk about these issues.
Right, and I think just as you mentioned, it seems to be a recurring theme is what the media covers on some of this. Usually, it tends to be the tail end. Even though, as we're looking into these things, there's indicators along the way. Here's the economy. Different healthcare things that they're protesting, and like you're saying, there's indicators along the way that you almost saw this coming, and now again, it's almost too late. Where now, look, this is the outcome that they arrived at because other issues initially weren't addressed along the way. So just to keep that in mind with some of these things we're seeing across the globe.
Yeah, absolutely. So should we go to the US?
Yes.
So
yeah. So focused on us, as you were saying,
mhm.
along that theme, we have here their inflation, and on the next slide, as you mentioned, the term which I just recently learned earlier today, about an hour ago, with the boiling frog. I was unaware of that.
So I shared the image with him, so it's coming up, right? So
Yeah,
so did you not know that?
I did not.
Okay.
Learned it just in the nick of time.
So, well, let's actually talk about that. Actually, I did probably use this in one of our earlier live events. So this is like in 2020 probably. Now, when we prepare for these events, we go through a lot of reading, and then we look into a lot of different things to make sure that we are providing meaningful update. I have to tell you, like, I get stressed. I'm stressed out from what I'm reading. So, like, in some days, like, I'm like, maybe it's better if you just don't read them. So, because if you don't read them, it doesn't happen. Now, what depresses me is the common people. What I mean by that is, what I see is they don't care. So they think that everything is just fine. And when they get like $300 check from the state of Delaware or from state of California, they're like, oh, wow, like this is great. So it's a stimulus money, right? So it's a subsidy. Well, that's not anyone's money to give it to you. That's the money that is coming out of your taxes. But people, how they are reacting, and then they think that they're getting free money.
Yeah.
And then people, they think that these, restrictions are good. People, they think that, the electric cars versus fuel, one is the only option versus the other. So there's no moderation, or there's no balance. And I kind of see this as like, they don't realize how this thing is going to get to, because the water is getting warmer. Sure. And then you don't actually realize that actually it's getting warmer, because it started very slowly, and it's just so like nice, because you feel like warm first, like because maybe you were in the cold. So then you're like, oh, like this is not too bad. So then by the time, because it's happening so slowly, boom, all of a sudden you are cooked. Yep, you're going to be served. So that's the boiling front. So when I hear like Biden being like having cancer one day, and the next morning I'm reading him being COVID, and then no one is talking about his cancer, it's concerning, right? Because that's important for us. Why not? Because we are violating his privacy, because he's our president. So if something happens to him, then we have to deal with the other one. So, and the other one is a little bit healthier than this one. So then, like, what's going to happen, right? So that's going to affect us. So, I pay 39% tax for every $100 I make. $39 is going to tax. So, and it's like, from because we have an office in Turkey, when those guys are watching this, they are not used to paying that type of tax. They don't show the income, or they like. I'm not talking about our employees there. I'm just talking about overall public. Yeah. We pay taxes here, so like then you know that everything that's happening with the government is affecting us. So therefore, like when I see people just now talking about COVID, and then they already forget about cancer, I'm like, well, how can that happen? So that's kind of reminding me of this. So
yeah. And I think that also, touches on the theme that you're saying, these past sessions where we see people, I know you had photos of lines where the city is crowded and people, like you're saying, you're getting these extra checks and a little bit of extra income, and it's it's what kind of want should I go out and treat myself to, as opposed to the motive behind it was to help you with the needs where you may not be able to afford certain things that are crucial. But like you're saying, people are out, and I think that they're not necessarily looking at the long-term outcome of some of their actions, where it's living day by day, and all of a sudden, like you're saying, the boiling frog, this will catch up to you because you're not noticing. From Tuesday to Wednesday, you're not going to notice that you went out to eat, and what that impact's going to have, months, years down the road on how this all will catch up to you, kind of like a snowball effect down the road.
That's absolutely, that's how it is. So, but again, I'm hoping that we can reach out to at least some individuals, if we can impact some people's lives. I know that not everyone is going to listen. Some people are going to hear these and then they're like, what the hell are they talking about? I hear those already. I mean, that's not our reach or our audience anyway, but we want people to think. So, and we want people to work hard, not just getting used to having these scholarships or subsidies or stimulus packages, because you are paying this, or you are taking it, you are trying to take from someone else to do it.
Yeah.
So we don't want that to be the new American culture, because this is the heart of capitalism, and that's what it is. Like, we don't want to become like big socialist governments or big socialist country that is going to be extremely difficult to live in. So
that's one of the lessons I remember from my econ classes, even back in high school, is that there's no such thing as a free lunch. So it's coming from somewhere. Somebody's paying for it, whether it's these taxes or other sources that are feeding into it. There's nothing ever given for free. It's coming from somewhere. So I think, like you're saying, when we're discussing things like this and people are looking at us like, what are they even talking about? That's kind of alarming on its own. The fact that if you're even unaware of some of these things that we're discussing here, that's kind of a signal right there. At least get familiar with, the 101 on the basics on how things work, and kind of, supply demand, just your basics. That way you're familiar with terms, and that way you can actually pay attention to what's happening in the news. If you see these things, oh, what is this now an indicator of? What are we going to expect from this happening? So,
well, that's, that actually is, there's another term that I use. I don't know if I use this with you a lot, but like, I think this, the culture of, I want to have my cake and eat it too.
Yep.
So that is what I'm seeing. And I'm kind of used to seeing that, just because of the position that I'm in. I'm mostly taking advantage of my either clients or friends or whoever. So, because I'm always on the giving side of it. But what you expect is the people to actually take ownership and accountability, and then own what they have. So, like the patients, like in some cases, like we see in the case conferences, the difficult patients are the most demanding ones, and then they are the ones who don't show up, right? And then there are 3 no-shows, and then they're still calling you 10 times, and then they are the one who complains about, why are you not answering the phone? Well, because you don't show up for your appointment. Oh, and also you have these medications that you should probably be getting it from a specialist. Oh, I don't want to go to the specialist. I want to do to him. Well, this is like having my cake and eat it too. That is unfortunately now becoming like a even broader problem. So people really need to kind of wake up and own their own life, and then understand that they are all accountable. So we can't expect what government needs to do to fix our lives. We really need to fix our own lives first, and then everything that we've been talking about is becoming reality. Like we said, like the interest rates are going to be so high if certain things are not stopping, right? So now what happened?
Yeah, so
interest rates are high.
Yeah, with the housing market too, we're seeing that there's a deep freeze, that nobody's looking to have any more mortgages, that the interest rates are going up. But it kind of just has me thinking here, where I think that the average for maybe like a 30-year fixed is over 6% now. But looking back historically, it used to be in the teens back in the day. And if people are able to actually buy homes with that type of interest rate, again, like you're saying, have the cake, eat it too. I don't understand what maybe the majority of these people are doing where they're unable to afford. 6% does sound high compared to 2020 when it was down at 2.4 or something. But if you're looking at historically, it used to be in the upper teens back in I think 80s, 90s. People were able to do it then. they had to be managing their money, making sacrifices, being smart with their finances, and planning ahead for this long term. Where 6% compared to the high teens, it's obviously less. Which how come people maybe aren't able to do that nowadays? Just makes you think, like you're saying, take ownership and kind of work and plan for your own future down the line, as opposed to a day to day. I'm going to live it, I'm going to go all out today. All right, well, tomorrow's going to come around, there's going to be consequences.
Tomorrow is always going to be there, right?
Right.
So, but we're hoping that, this can maybe open up some people's,
I hope.
right? So,
The blinders are on.
blinders.
Yeah.
So, now next week we have Dr. Erkan is going to be back for the Bariatric Friday at 3 p.m.
Right.
Today we don't have Bariatric Friday. So Katrina and Samantha are going to be waiting for Dr. Erkan to come back. So we do have a guest,
Yes.
clinical guest.
Dr. Dubois, I believe, from Brandywine Podiatry. She's
Yes.
talking on, I believe it's wounds is what the focus
Yeah,
of the.
from Brandywine Podiatry. Brandywine Podiatry is the premier podiatry group in Delaware. They're part of our ACO. Dr. Chris Savage is part of our ACO board, UMACO board, and it's one of the best podiatry practices in the region. And we are going to have 2 guests from them, but next week is the first one.
Yep, the other one will be beginning/mid of August. We'll have a second follow-up from BPO. Yep.
That's great. And I guess that's kind of what we have for today. So those who may be missing Katrina and Samantha, we'll put their pictures up there as well. So they have to wait until next week, but they're doing good anyway. So these are, remember, like, names are not real, but they're actual people.
Yeah.
So and then they will have surgeries next week. Or one of them may have done it this week actually. So all right, well, that's all we have for today. It is extremely hot out.
Yes, hopefully everyone hydrates and stays cool.
So for those who are complaining about my office being so cold, so you can just go in and enjoy the hot weather. But other than that, we'll be back next week. Thank you for being with us, and we'll see you soon. Bye-bye.
All right, bye-bye.